There you go. That's it.
Hey y'all, it's good to see y'all. For those of y'all's first time that are here, I'm Brianna. I'm the clinical social worker here, and Jenny is our dietitian. So I'm glad y'all are here. Happy New Year. It's good to see all of you guys. We're excited Jill Smith is here from Jill Smith and Associates Counseling. I know you guys hear me talk about mental health all the time, but I think it's also beneficial to hear from someone else who's been doing it a lot longer than me and sees all different types of patients and situations. And it's always good to hear from someone else that's not in the office that you talk to on a regular basis. But we're so glad you were able to come.
Thank you.
And a couple little updates we wanted to share with you guys. I just put the Vision Bingo card up there. I thought it was helpful. It's not something we're going to play, but for you guys in the new year, I thought it was kind of helpful of looking at that as a sample of goals that y'all can set for yourself. I know Catherine, our dietitian in one support group, talked about the importance of setting SMART goals. And again, specific, measurable, achievable, relevant time. So not just, I'm going to go to the gym, marking out, I'm going to go to the gym Monday, Wednesday, Friday at 7 p.m. You know, making it specific so we don't make excuses for ourselves, right? Of making it too broad where we don't meet it and we just make it, like, again, excuses. So but also like thinking about not just health related goals, but of course mental health goals, and taking a step back of certain social aspects maybe we need to improve on. A big one that I've seen on a lot of our we've done it in our office too with employees, is limiting screen time, you know, putting timers on stuff. That's a hard one, but it's so needed in this day and age. I look around at my children's schools, I look around at us at home sometimes, and I'm like, what are we doing? Like, but putting a limit on everything is so helpful. So those are for y'all's personal use to take home. I encourage you guys to fill it out and put it somewhere. So as you mark off stuff, you're like, okay, I got this, I'm gonna keep going. I think it's really helpful. So would love to hear y'all send us what some of y'all's goals are. We'd love to post feedback of that. I did also want to update you guys. Emily Coles, our dietitian, she's been with us. She was with us for about 10 years. She transferred. She has moved on to IT world. We miss her a lot, but we're happy for her. IT provides a little bit more flexibility in her world where she needs to be a mom right now. And so she has this opportunity to work a little bit more from home, work in the office, and do a whole nother realm of things. So change sometimes is good for her. And not to go into it, but she has a degree in dietitian and IT, so I didn't know that until this. So this is good to change for her. But yes, so those are the two things. But we're so glad to have Jill. Jill has 2 offices with a good amount of therapists now. An office in Columbia, an office in Lexington. To brag on their offices, here recently they've won some local awards for best therapy practice, best local therapist, all kinds of stuff. So it's very neat for her to be here. Oftentimes, when I do complete psychological evaluations for patients to move on with bariatric surgery, sometimes I recommend counseling sessions, you know, to either continue process trauma, process recent stressors, learn new coping skills. There's all kinds of stuff. Grief is a big one too that I see. All kinds of situations. And I probably tell 98% of my patients, if you ever need counseling, going through bariatric surgery is probably the time you need it. Before, during, and after. You have that extra support with a counseling service and a therapist. Hey, you guys. That they hold you accountable, they're extra support, and it's a relationship that helps you guys be successful. because sometimes we don't get the support we intend at home. So this is an additional resource outside of our office too. So we're so happy that Jill's with us. So if y'all have any questions for us, I told Jill, I said we're an open group. So as questions come up related about her job role or experiences, please make this kind of an open communication. So we're not just talking the whole time. This is y'all's group. We say that all the time. So let us know what you guys need and what specific questions y'all have as they come up. So very good. But so glad y'all are here. So glad you're here too. Thank you.
Thank you. What a nice introduction. And I love, you said the word relationship, that therapy is about a relationship. And that is so true, that when we're doing a good job as therapists, we make you guys feel, and we are experiencing joy that you've come in to see us. And through the relationship is a lot of the way we think that change happens. And so I like that relationship word. So it's definitely not, even though you're paying for the service, it's much more than that. It becomes there's a kinship and there's a connection. So that's my favorite part about counseling. So you don't have to raise your hands, which you can if you want to, but how many of you have considered going to therapy? Give me some nods. Okay, I see some little hands and some nods. Thank you for the nod. And some wide eyes. Like, it's interesting. So thank you for sharing that. How many of you have been to therapy? Okay, cool. Oh my gosh. And this is a great group. I mean, usually when we host a group, we get like 3, maybe 4 people. We're like, it's like pathetic to get people to come. But look at all of you guys. This is wonderful. And every month is like this, huh?
Once a month. Yeah.
I might just have to come hang out with you guys.
Yeah.
So I'm impressed. You're doing something right to have this healthy of a group that is like coming, and especially on a cold winter night. But yeah, so therapy used to be, and we call it therapy, we call it counseling. We sort of use those words interchangeably. As you know, there's other kinds of therapy, like physical therapy, or I can't think of another kind of therapy right now, but there's other kinds of therapies. And so sometimes that word therapy is confusing to people. If I say I'm a therapist, they'll say what kind. So then that's when the word counselor comes in handy. But so I'll bounce back and forth between those two words. But it used to be that people came and they were kind of secretive about it. And it's baked into our rules that we're not supposed to talk to our clients outside of the therapy room for that reason. Like, it's private and you don't let anybody know. And that makes sense because it is private, and we want people to feel entirely safe in choosing to go to therapy, not like that we're going to be called out in Target by their therapist going like, "Hey, it's me, your therapist," which is what I would want to do. But things are changing. Things are changing, like right now as we speak. We're in the middle of a whole change with counseling. And people are now talking about it. I was at 2 holiday events this Christmas. I didn't get invited to very many, so this is the only 2 I was invited to. And at both of those events, people told me they were coming to one of my counselors, and in both instances it was a man, I'm looking at you guys, and they said it in front of other people. So it wasn't like they pulled me aside and said, "I want you to know that, I like your therapist, Sarah." They said it right in front of, like, it was a part of the conversation around the chip and dip. So things are really changing, and that's really kind of cool because more people are coming, more and more guys are coming. So I see people in our waiting room every day that look like you and me, that are just regular people that, don't have any necessarily experience with what's going to happen, or don't have any more right to be there than another person. They're just folks. And they also come in as couples. Sometimes people will start on their own, and then they will, transition, and they'll say, can I bring my person in with me? Because we're having problems too. And so it's kind of a fluid, comfortable, let's do what makes sense for you. Yeah. And, I'll say a little bit about this, and then I can answer questions about this part later. There is a cost associated. Now, a lot of insurance policies now cover therapy. Some places also take Medicaid, and Medicaid covers therapy. So there's options. And then if you don't have either one of those, insurance or Medicaid, or if you go somewhere that doesn't take insurance or Medicaid, then a lot of times there's sliding scales. So, please don't think, go out of the gate, I can't afford this. And if you call our place, tell them Jill said to talk to you about the fee and not just say our fee is this. And they're not supposed to do that anyway, but we want you to come. So, yeah. So, you mentioned earlier, Brana, am I saying your name right? Brianna.
Yeah.
That, a lot of us have trauma. And then you also said recent, you had a nice way of saying it, like recent, episodes or bumps in the road with life. A lot of us have difficult childhoods. And then, well, I guess I should say most of us have one of those three things, right? I mean, I've yet to meet a person who had a perfectly normal childhood with no issues, thought mom and dad were perfect. And if you do think that, then that's probably a problem in and of itself. Okay. No, there are some great moms and dads out there. But even the best intentioned parents make mistakes with us, right? Sometimes they are too firm with us. They think they're doing a good job and keeping us safe. But we wind up feeling like, oh gosh, we have no freedom. Or they're too relaxed, trying to be super cool and hip. But we felt scared because we didn't have enough guardrails, right? So the best out there, parents out there can make mistakes. So we all have things that we want to talk through, typically, or could talk through, that would then help us feel better today. Because even though all that's way in the past, it affects us today in small ways. Like we might try to parent just the opposite of how our parents parented us, and then our kids tell us that's the wrong way. Or we might feel like we get angry more quickly than the next person. Maybe our partners are telling us, and I know you're taping me, so I'm trying to stand about in the same right place. It could be that our friends or our partners or our parents tell us, you're angry a lot, and I don't know why, because I don't think that this deserves this level of anger and yelling and outbursts. It could be that we retreat. And, we never really learned to believe in ourselves, so we don't, we don't put ourselves out there as much as we would like to, or, we stay kind of hidden, and that starts to feel yuck to us. So there's lots of ways that what happened in the past can affect us now. And I just sort of course, named a few. But those wounds, you could call them, that's kind of a big word, but those those little hard places when we're growing up also make us sometimes feel it, like it's like if you go to Chick-fil-A and you get the spicy chicken sandwich and the large fry and the chocolate milkshake, and then afterwards your stomach was feeling not good. It is like that, in that the old wounds or the old bumpy spaces kind of live in here and they feel kind of painful until we find a way to work through them. And it doesn't mean you have to come in and plop down and tell every bad thing that happened to you. It's a slow process, and you might not even tell all the things. It's totally up to you. But it's just a place to begin to sort of work through that, so you feel better inside your body, that and you don't wind up doing things to your body to quiet that pain. And that kind of brings what you guys are doing. You're looking at, how can I be healthier, right? Everybody in this room, I assume, is paying attention to how can I be better to my body and how can I be healthier. What do I need to learn? What do I need to do? What medicine? What options are out there? How can I be better? And so that's really cool, because there's a lot of folks that never look at that thing. They just do things like overeat, or under move, or drink too much, or, abuse drugs, or they are rageaholics, or they spend way, way more than they should, or they turn to pornography. They do other things so they don't have to feel that chicken sandwich feeling, that yuck feeling inside. And so it's common to do things to numb that feeling, to get our mind off of it, and to, I would say that all of us do that to some degree. It's not like the people who have it figured out are over here and everybody else, the people who don't are over here. We all are in this really challenging place in life, like trying to figure out how to feel healthy inside our mind and inside our body. So therapy helps us talk about all those things that we sometimes use behaviors to cover up, behaviors that aren't good for us when we stop and look at them. So you guys are giving me great eye contact, and great nodding and smiles. What about, like Bronna said, any questions or comments?
Do you accept EAP programs?
That's a great question. Many practices do. Mine does not, but don't let that be a deterrent. Still call us and we'll see if we can figure something out. Did y'all hear that question about an EAP program?
I was going to ask that too. I'm happy she said it.
Oh,
My
you
job
were.
offers it.
Yeah, that's a great benefit that a lot of jobs offer. They offer, it's called an employee assistance program, and they will give you a few free sessions to go to therapy, and it can kind of kickstart you into therapy. And so that's a great thing to take advantage of. So, yes. There's a lot of reasons why we don't take it, but none that you shouldn't use them. It's a good benefit.
Oh, go ahead.
No, you go ahead.
I was just going to say, everybody in our programs get a lot of specific education. What to eat, when to eat, how much to eat, and people do really well. A lot of people in this room have done excellent, super, super duper well. But over the years, what I've seen is then life happens.
Yeah.
Right? Sometimes wonderful, great, celebrating, birthdays, anniversaries, great long vacation, and people get totally off track. Or, as very difficult things, job loss, loss of, loved ones.
Exactly.
And so, and that's where the rub comes. Our job is really getting people back focused on their health again.
Mm-hmm.
So how could therapy help in those areas? Whether great, excellent, fun, wow, I really got off track during the holidays, or, I'm in this period of grief.
Yeah.
How could it help with those things?
Well, I love that question because, I love my analogies. I'm trying to think of an analogy right now that works in my brain. But you're absolutely right. Life is kind of like the seashore. Let's say it like that way. Like if you were at the beach, every day you went down there, if you took a photograph, you would not see that same photograph again. Right? Or like if you have a favorite tree in your yard or a favorite flower, every time you go look at it, it's a little bit different. You still recognize it, right? It's still your azalea, or it's still your rose bush, or camellias are blooming right now, still your camellia bush, but it looks a little bit different. Life is like that. So we do change. We can learn some great skills and feel really empowered, and that be honestly how it is for us. But then something, the days go by, the weeks go by, like you said, we have a celebration, we have the holidays, we have a heartache, a heartbreak, and, we find ourselves changing a little bit. And that's okay. We need to experience that grief. We need to experience that sorrow. That's the whole, they say, and I guess I believe it, that's the way we feel joy, is because we have sadness too. Otherwise, joy wouldn't feel like anything if it was always joy. So it's okay to have those hard times, But therapy can really help us bring us back to baseline. Or it can be a place that you touch base. You know, really our favorite thing is when people stay with us forever. I mean, that sounds like a long time. But when people just stay with us. And sometimes people will stop for a while, but we'll say, you know, you come in for a maintenance issue, maintenance check-in when you need to. So you know you have your person that you can call to come back in. When you have kind of gotten, you know, away from that feeling of check, 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 I'm, you know, going to eat breakfast every morning, or I'm going to, you know, substitute this for this. And that's normal. But therapy can be kind of your constant in the road to help you take care of you. That's another way to think about it. When you're in therapy, it's just you and the other person, right? And again, it should feel comfortable. It shouldn't feel weird. You know, there's enough distance between y'all, and you know, it's usually a very cozy room, but it's just you. It's just you. I mean, how many of us ever get to just think about ourselves and not think about someone we're responsible for or that we're worried about, even a coworker? You know, how many times we get to just be yourself and focus on what you need to talk about and what you need to say and not be judged for it, and have someone really care and really be interested? I mean, it's an important part, we're saying now, of overall health. You know, we do things like walk and watch our diet and try to get better eating habits, and we go to the heart doctor, and we go to the primary care physician, and we go have our colonoscopy. Right? Should I stop? I probably should stop. But we also now know we need to take care of our emotional world and our emotional health.
Yeah.
That's a part, we believe, of just regular health care. So
I'm so glad it's finally catching up. You know,
I know.
You know, the emotional part was, like you said, so hush hush. But we're seeing, if we start with the emotional part, everything else sometimes naturally occurs. You know, like if I'm feeling better and my depression lowers, my anxiety lowers, I have more energy to go out and walk.
That's
and you know, go to the gym. I try to explain to patients, when we're severely depressed or anxious, we're in survival mode. We're not thinking about the other tasks we need to do to take care of ourselves. So really the emotional part, of course, because I'm in the mental health word, I think it comes first. Like, it's the first stepping block sometimes.
You're so right.
So I'm just so glad, like you said at the beginning, it's finally coming around to being more talked about.
Me too. It's really an exciting time to be in the mental health profession and to be, you know, a person, especially in our country. Other countries too have it available, but we do have a lot of therapists in town and a lot of options. And you have the mental health resources here. Yeah. Yeah, but you're right. When you're depressed, I mean, one of the things depression does is it slows down your brain and your system. And so you don't want to if you're very depressed, you may not want to get out of bed. And I mean, full disclosure, I've been there. I've had severe depression. And it's no fun. It's no joke. And you either, you know, everything can change. Your sleeping patterns, your eating patterns, your ability to make decisions, your ability to cope with anything. And you certainly, or I know I certainly didn't want to get up and, you know, make a healthy meal or take a walk outside. So it's very connected. And anxiety too. Anxiety is so exhausting. I don't know if there's anybody in here that is like, yeah, I have anxiety, but many of us do. If not most of us have some degree of anxiety, which is just sort of excessive worry over things that, you know, may not even happen. You know, we all are worried about things. Gosh, I want to get to the meeting tonight on time, or I hope it doesn't snow Friday, because if it snows, then, you know, that's going to block me from getting to this that I've got to get to. But anxiety really is not doing us any favors. It's telling us to worry more than we need to, and sometimes about things that we don't need to worry about. And that's exhausting, because your body's kind of like wired, you know, in a way. And so you're pooped at the end of the day. and sometimes at the beginning of the day. And so you don't want to have the energy to take care of yourself typically. So you're right, it's all very connected. So what's coming up for anybody? You have a question.
Me?
You. Do you have a comment?
I mean, I'm just going back on like anxiety. I mean, just admit it, I have anxiety myself, so I suffer with it. I have a lot of trauma and stuff like that from having anxiety. So it's just a struggle, and it has affected my weight and stuff like that too, in that sense too, in that part. But you're right about everything. But yeah.
And then when you say it out loud, it makes it more real, right?
Yeah,
and
it does.
it's
Like
hard
when you
to
say like, oh, yeah.
it's hard to say it out loud,
When
but
she was saying it, I was looking
you're
at her
just
like, yeah, it makes your brain go so fast, like per minute and everything like that. But I mean, there's options there. You got medicines and stuff like that to help you too.
Yeah.
Yep, and to help you calm. And because I have anxiety more at night because you think you're in the bed, you're relaxed. So stuff like that, it helps. Stuff like that. So.
Well, I'm just really tickled that you were brave enough to say that.
Yeah.
You know, saying it out loud, what a cool thing. And may I ask you, how does it feel that you said it out loud?
Maybe
you said
like
it before.
because I don't really get to talk to a lot of people. I only have like maybe one or two friends that know I have anxiety. So it's hard sometimes to say it out loud, and a little scared to say it. But yeah, I probably 5 years ago I probably wouldn't say it out loud.
Wow.
But now that I'm older, I've been in therapy myself, and
Wow.
and have to be prescribed stuff for anxiety. I feel better in life because struggling with it is hard. Like, it's a very hard
Yes.
thing to deal with.
Yes.
Especially by yourself, because my mother's older, she's a baby boomer, so she doesn't believe in therapy. She has bad anxiety. I have to, the coping stuff I got in therapy, I have to help her
yeah.
do stuff. So, my father passed away in 2018, so my mom was more fragile. I feel like my daddy calmed her down, so I feel like now I'm the person, because I'm her child, to calm her down and help her with stuff I know, so.
And now you're probably recognizing what her anxiety always looked like your whole life,
Yeah.
and you just thought it was her personality.
Yeah, I
you know,
thought
the
it was her
anger, the
personality.
irritability, all that, and so now you're helping her.
Yeah, I help her with her anxiety.
Wow.
Even though she don't want to listen to the therapist, but yeah.
Yeah, do you realize you're smiling as you talk about this?
Yeah,
I don't know if you
yeah.
feel yourself smiling,
It's
but
happy to get it out.
yeah, I love that. Thank you. Thank you. Yes.
Kind of going on what she said. So I'm in therapy. I have been for several years, and I find it great, wonderful. I tell everybody. I genuinely believe everyone can benefit from it. So, like,
Can y'all hear her?
So
'Cause I
my
wanted to hear you.
my question is, we all have those people in our life who are the stressful relationships. What's like the quick one breath elevator speech I can tell them? They're like, hey, maybe you should consider it. Because if I could have anything I want for Christmas, it would be for certain people in my life to seek therapy. I think probably we could all agree with that.
Absolutely.
Like,
Yeah.
what could I say to be
Yeah.
like, hey, it's not just for crazy people. It's not, decades
Yeah.
ago anymore.
Well, we might have some collective wisdom here. So her question was that she has people, and you help me because I might paraphrase it wrong.
That's okay.
But she has people in her life that she loves dearly that really, she feels like really could benefit from therapy.
I would benefit if they went to therapy.
You would benefit if they went to therapy. Totally get that. And she said, like, what's the quick, elevator speech? In other words, quick things she could say to really encourage them to go. So, anybody have ideas?
I guess I can give an example for with my mom. I try to. It would benefit her for my mom to go too, but I tell her a lot, like, "Oh, Mom, you might want to just talk to," because she's works for the federal government, so she works in the VA, so she should be able, like, "Hey, Mom, you don't want to stop by?" And she tell me the lady name, and I'm like, "Hey, you want to stop by her and just talk to her for a second? Maybe do that, or
Yeah.
mention, maybe show her like how it's benefiting you to them, like
Mhm.
maybe something that you learned in therapy, maybe tell them real quick."
Because you said you're in therapy?
Yes.
Did you share that?
Yes.
Okay, I missed that part.
Yes.
Yay.
And I felt a lot of benefits from it, and I share. I'm specifically talking about my parents. Like,
Yeah.
my parents they're very much like, oh my gosh, how could you? Like, that's terrible. They very much are like, that's a secret we should keep hidden. But I tell everybody. And so I just like, they would just go.
Your
A lot
parents are probably in my generation where we grew up to think that
Yeah.
if you go to therapy, you're crazy. Or, you
And
know,
they-
you didn't, it was on
Sure.
the download, you never spoke about
They
it.
raised me to believe that too.
Yeah,
Yeah.
because in that, I mean, in that time, it was like that.
Mm-hmm. Mm-hmm.
So I'm like, how can I just?
Well, that's a toughie. The first place I always go with that question is get in therapy yourself, because I think I've had very little success in my life telling other people what I think they should do or what would benefit me if they would do. Now I'm speaking of my husband. You said you're speaking of your parents. I'm speaking of my husband, right? So I've got all kinds of things that he could do that would be good that he's not really interested in hearing. So I have learned the hard way to walk the walk. If I want him to be less fill in the blank, messy, then I need to be less messy. If I want him to go to therapy, then I need to go to therapy. And that's many times that will start softening the discussion. Now, when we have generational differences, it can be really challenging. But what a good therapist will help you cope with the untherapied people in your life. Like, they should be able to give you really good ways to not be as triggered by mom and dad or husband, because some things aren't going to change, right? And we're going to choose to keep people in our lives many times that we love. And so another example that comes to my mind is children. A lot of us have children, adult children, and they are often making choices that we might not have thought they were going to make, or we wouldn't choose for them, or they have an attitude, or they're too distant, or whatever. Most of us are still going to want those adult children in our lives, but we need to deal with the fact that it's not exactly as we thought it was going to be. Maybe they moved across the country, maybe they don't check on us when we're sick, I don't know. But so we have to learn to cope with what is with the people that we love. So I'm not really answering your question. I'm just tap dancing around it. I don't know if you can tell. But I really do believe that most of the pain that we feel, and if we think about being triggered as a painful feeling, back to that rumbling in our stomach, we don't want to feel pain, right? We don't want to feel emotional or physical pain. So we will usually work hard to not feel that pain, even if it means that we're doing all the work. We're doing all the work, and the person that mom and dad aren't changing. There is a new book out called something like But What Will They Say? And it's about that intergenerational and also cultural. From what, as a white woman, I can only tell you what I think I've heard and know, and other voices in the room can help here. But from what I'm told, this is particularly the belief in African American families and also in Asian families, on people of other cultures really do not want, historically really do not want to be telling anybody else their stuff, right? And do you have a comment here for me? Because you're giving me good, yeah. So, and again, not judging. If people don't want to do what people don't want to do, that no judgment. But if that could help them, I know if you love someone, you want them to get that help. And so that's something we're trying to learn how to change in our society. And interestingly, there are a lot of African American therapists in our community, in Lexington and in Columbia, and a lot of African American clients. We have lots of clients of lots of different colors and educational backgrounds. We have police officers come in. We have truck drivers come in. Construction workers come in. And so, again, things are changing, but probably, some folks more slowly than others.
In your practice, like, how do you match people with therapists? Like, if someone would say, yeah, I'd really
Yeah.
like this, how do you?
That is hard to do. We have a wonderful scheduler who has a conversation, or sometimes we get an email, like, you know, it comes in through the website. And it depends on, you know, what, if they're an individual and they want individual therapy. So, you know, someone my age that wants individual, we're going to try to match with someone who maybe has some of the same life experience a little bit. Couples, we have a lot of people that come in for couples therapy, and we only give them to therapists that have really in-depth couples therapy training. Sometimes men will ask for a man. Sometimes men will ask for a woman. That, you know, they will say, I don't want to talk to a man. I want to talk to someone that, well, they don't say this, but I'm thinking that they're thinking more of a mother, you know, someone, maybe mom was easier to talk to than dad. It's just more of that feminine energy is what they want to talk to. But some guys are like, yeah, I want to talk to a dude. And so we have male therapists. But so we kind of, and sometimes we it isn't a good match. And then we always encourage the clients to let us know, and then we carefully introduce you to somebody else. Yeah, that's a good question too. Tell me when you've had enough of me.
Oh, no.
That's great, it's wonderful.
Any other?
Other thoughts?
Do you have a psychiatrist on staff, or do you ever refer people to psychiatrists?
Yes, great question. We don't have a psychiatrist on staff, although we would love to. We do have a psychologist, and so I'll answer that in a couple. Yes, we refer often. Usually, a couple of things about that: medicine, and then the names. Let me talk about both of those. Now, you know, as many of you know, and some of you have been really cool to talk about, now we have medicines that help us with the way we feel. And the research says that if you're feeling really depressed or really anxious or something else, like really mood swings, or, you know, everyone tells you that you're hard to get along with and this has happened your whole life, you know, problems, then we know that medicine and talk therapy, which is the therapy we're talking about here, counseling, is the best approach to couple that with talk therapy with some kind of medicine. Now, a lot of people don't want to take medicine, and that is, again, absolutely fine. It's your choice. But usually your primary care doctor, like your Lexington family practice doctor, will prescribe a medicine for you. So you don't have to go to a psychiatrist. So they'll start you with Zoloft or Prozac, or one of the medicines that you've probably heard about, Lexapro. And that's no big deal for them. Everyone else in their office is on it. They might as well put you on it too, right? Now, if you take it and you don't feel good, you know, like, I don't like this, I can't sleep, or I don't like this, I feel funny, they'll probably change it. And then if you don't like that one, then they might say, okay, let me refer you to a psychiatrist because I'm not, you know, I'm not exactly sure what we need to do here. So a psychiatrist is like a doctor, is a doctor. So if you go to see a psychiatrist, they can write prescriptions. And they're like at the top of the food chain in medicine. So they're just like your cardiologist or your bariatric surgeon or your, you know, your other doctors. Psychologist is the next rung down. And we do have a psychologist in our office. And what they usually do is they help figure out what's going on. If you're complicated and it's like, I'm not really depressed, I'm not really anxious, but I'm, you know, I have, you know, a bunch of problems in life, failed marriages or failed jobs, or I feel really strange and bad inside, then a psychologist will meet with you and help figure out, okay, what do we think the diagnosis is here? That then the psychiatrist and the therapist can help with. And then the therapist is below that. So we have the least training, typically, unless you get a doctor in therapy, a doctor in counseling. But we're master's level, but we can't typically test that thoroughly, or we cannot prescribe medicine.
So if, you know, like, for me, over the years, I had been going through therapy until I started here and had the surgery and stuff, then for some reason, I wasn't going. Anyway, if for some reason you got misdiagnosed somewhere down the line, how could you get that corrected? I mean, nobody, what I see on my papers is not what I've been told. How do you get that corrected?
That's a good question. So like when you say that, you mean like when you go to my chart, you might see a diagnosis that is not right anymore.
Yeah, well, it's not what I was told that I had.
Yeah.
Yeah.
That can be complicated, if you're okay with me
Oh, yeah.
answering that. If it's in my chart and you do not agree with that diagnosis, and no one that you're actively seeing put that diagnosis in your chart, you
Right.
would need to go to medical records and go through that whole process of talking with them about getting that removed from your medical record. Mental health wise, we try to be very, very cautious of putting any diagnosis in a chart. I can talk to someone about symptoms adding up to something, but I often say, you know what, I'm not at that level like Jill talked about of putting an official diagnosis that you didn't disclose to me in your chart, because
Right.
then that stays with you. My chart pops up, and then your primary care asks you what in the world. So if there is an old diagnosis from more than 10 years ago, definitely have to go to medical records and figure it out that way. But if it's a primary care or a cardiologist or myself or someone that has put it in your my chart, start with having a conversation there.
Yeah, but the thing is, you don't know where it came from.
Yeah,
Just-
that's
That's frustrating.
That is frustrating. It is.
That's frustrating. It may be that it doesn't impact anything.
Correct.
It
Yeah,
may,
that's true.
I take it, I would not like that either. I
Yeah.
totally agree with you. But it may be that it doesn't really matter. No one's gonna really look at that and then say, you can't do something you wanna do. That's what I would, my guess
And
would be.
sharing with your doctor, look, you may
Yeah.
see this in there, but especially your primary care, you may see this in there. I don't know where it came from, and they'll be aware of that when y'all have that conversation. But like
Yeah.
Jill said, or if it's many, many years ago, more than often, that doctor is looking at the specific reason of why you came into the office, and not focusing directly and changing anything about their treatment of care based on that diagnosis. Most of the people that are looking at that diagnosis are mental health providers.
Right.
And there are not many in our My Chart system except me and one other person. So, and our inpatient psychiatrist. So, make sure your doctors are aware of that if you can't go down the loop of getting that removed. But your primary care or cardiologist, nephrologist, they're not going to change anything about your treatment because that's there. They're mostly looking at your medications that you're on, your lab work, stuff like that. But it is frustrating, no doubt. But that most of these medical doctors aren't going to change their treatment of care based on that being in your chart.
Yeah. Sorry that happened though.
Yeah.
Well, it's not only the mental thing, it's the medical, something medical shows up, and I'm thinking like, where did that come from?
Yeah.
And my chart's tricky too of having long-term diagnosis and your medical history and then problems. And problems sometimes, if you go in for a UTI or whatever it might be, it may stick on there. And it's like, well, I don't have that now, but it was a problem that you went in for something at some point. So
Yeah.
that can be tricky too to navigate that in my chart too.
Yeah. Well, you get a koozie for asking that question. And you get a koozie. And you get a koozie.
As there's only a few more minutes left, any other questions for Jill while she's here about mental health, what you're struggling with?
Do you have any counselors who focus on things like disordered eating, that kind of
That's
stuff?
a great question. We
That's-
do. We do, and, that's a real growing area of interest, and disordered eating is something that we do have a small group of therapists that do work with that, and they also have a very good relationship with some of the, well, we have one, in my opinion, we have several, so I shouldn't say that, but there's a couple of people in Columbia that's all they do, right? And so they're hard to get into, and they may not fit, but we can coordinate with them. We can also coordinate with dietitians and so on. And there's a lot of us that are doing a lot of work around just the whole body positivity movement and feeling more, moving into this neutral space that as a society we're trying to do, where we don't judge, that this body is good and this body is not good. We're trying to help people, because so many of us do that. We look in the mirror and it's not okay what we see, and that's so sad. So, the media is slowly getting on this bandwagon. Like, if you go to Target, if you go to CVS, sometimes you'll see larger sized images of the women on the walls and larger models, and the men too. And but the whole body positivity thing, where there's not a right or a wrong. And we focus more on helping our clients think about how grateful we are for these bodies that walk us around and process our food and help us see the world and hear the world, and just thinking differently about our bodies with gratitude rather than with judgment. So yes is the answer.
I think our patients deal with two ends of that. One is, ideal body weight graphs that were developed in the 50s by insurance companies, where most of the people
Yes.
smoked. But then the other end is body dysmorphia, after they lose significant weight. Do you guys have experience with that?
Body dysmorphia?
Yeah.
Yes, we do. We do.
Yeah.
Yeah. It's hard to see ourselves in a new light.
Yeah.
And then that's, when we literally feel like we are seeing something that isn't there,
Right.
right? And that's probably more common I think it's more common than I initially thought.
Yeah.
So, did everybody get one? Yeah.
A lot of our patients will talk about, I went to go shopping and I couldn't believe I was 2 sizes. I went to this one area
Yeah.
and I had to go to this other
Yeah.
area because nothing fit. I was way too big.
And it's like, it doesn't
It
really
hasn't
sink in.
caught up. Yeah.
Right.
Yeah.
We have a lot of teenagers with that feeling, or even younger kids,
Really?
that, feel like they look in the mirror and their nose is huge, or their skin is not good enough. And to our eye, they're beautiful. Again, there's that word. But, we don't see what they see.
Right.
And so it's, it's tough. But hopefully talking in a loving environment helps. Yes, sir.
Y'all do family counseling too?
We do. We do. We're a big believer in that. That's another thing that's getting more and more popular. And people will bring in their adult children, or the adult children will bring in mom and dad, and we see everyone together, and then we might break it out and just figure out what the best thing to do is. Yeah.
Thank you.
You're welcome. Thank you. So there's extra koozies and there's pins. So I didn't hand out the pins, but I want y'all to take one. I'll leave them here. And
But thank you so much.
thank you. What a great group.
you. Yes.
Can I come back next time?
Yeah, you come back anytime.
All right, I'll be here. I'll follow everybody home. Thank you. Thank you for being such a good audience for me.
As we wrap up, does anyone have any questions, dietitian questions, or anything about the process that you're going through? Yes.
We're in the soft food stage of our after surgery. What's the big thing on caffeine? You can have decaf coffee, you can't have caffeine. Is there something that's going to irritate your stomach? Or
Well, initially after surgery, it's a vasoconstrictor, constricts your blood vessels. Caffeine does, have you ever heard, if people have headaches, they'll say, have a little coffee or caffeine. That's because your blood vessels in your head will reduce.
that's part of the healing process?
And so here you've had, major surgery and you want good blood flow and healing. You don't want constricted blood vessels. So at least for the first couple months after surgery, but after that, you can have, coffee or caffeine. With coffee, our concerns are the sugary syrups and, the cream, and you can turn a 0-calorie cup of coffee into 300 calories pretty quick.
Yeah.
Well, I want to ask a dietitian thing. I'm like a week behind him having my surgery. Is it such a thing, this is what I'm going through, is smell and taste has completely changed.
Yeah.
Protein shakes about make me throw up.
Oh my God.
Just
Yeah.
even smell them.
I'm
Yeah.
so tired.
He had to get outside the car
Yeah.
and finish drinking one. And then when he got in the car, I had to give him chewing gum because I was about to get sick. So I'm not, I can eat yogurt, but I mean, putting chapstick on earlier.
Yeah.
Smelled so bad, I had to chunk it
Yeah.
and wipe it off my mouth. Is that normal?
Yeah.
I mean,
Yeah.
that happens. Will it change?
A lot
Will
of
I go
times
back?
you'll be in something called ketosis, which really changes your taste.
Yeah.
And it can it can change your food preferences. A lot of patients will tell me, I never liked this, but now I love it. Or I used to love eggs, and now I don't really
Yeah.
love that at
That's
all.
what I'm doing now.
So, and then
it's
it
crazy.
changes over months, right, Ryan? Would you say that?
I still, I'm 18 months out, I can't even look at a protein shake.
Yeah.
No.
I mean, he's drinking them, well, I call him my little sergeant
Yeah.
because 8 o'clock you're supposed to drink this, 10 o'clock you do this. And he is on time. We went somewhere and he had to be home at 2:30. I said, why? He said, because that's what time I eat my lunch. I'm going to eat when I get ready, and I'm going to not eat when I get ready to do it. So he's a sergeant.
That's why you're
but
married.
we 50 years married, so, But
So
yeah,
all that's normal,
it's just
And
strange.
it's normal to have no
Protein shakes are
changes.
the worst. I mean, they're,
I can't.
he can't stand the smell of yogurt. I love yogurt, so I'm getting my protein in.
Good.
Just not as much as Sergeant here is, but yeah.
Myself.
So, okay. See,
I had a question, I know she's left now, like, do people have her contact?
It's
says
on here.
the thing.
Oh, it's on, all that, okay.
And if you need any questions, like if you need
Yeah, you
us to
can
send a
go through
referral,
Brianna.
anything like that, we sure can.
Yeah. I was just making sure they had your contact information, they all held up your little koozie.
Oh, yes, it's on there, the website. Thank
Good.
y'all.
Good,
Thank
thank you.
Can I ask a question? I haven't got to surgery yet, but I still research and just ask questions.
Yeah.
So I don't like, what's it, cottage cheese?
Yeah.
Does that, I like a lot of the research are like TikToks, and I'm on a little group on Facebook. Everybody is like so big on cottage cheese. Like, I don't like cottage cheese, so I was thinking like, and everybody's like, oh, you should try it, and before
It's having a day.
Yeah.
If you mix it with, I found a recipe. You do a cup of cottage cheese and 4 eggs and salt and pepper and season it, and then you bake them into little egg bites. You can't even taste the cottage
Oh,
cheese.
okay.
I got my first scrambled egg this morning. Yay! And I mixed it with cottage cheese, and I've never had cottage cheese, and it was the best scrambled egg I've ever
Okay.
eaten.
Do it.
It's
And you
beautiful,
can't
Ann.
taste
It's
it.
beautiful, Ann.
You
Yeah.
blend it. Okay, that's what
Yeah.
I've seen a lot of people say. They
I've
blend it.
seen this
I
recipe
guess
too.
I have child trauma. 'Cause
I
my
would have
mom
never
loves
thought I
cottage
would have
cheese.
liked cottage cheese.
Cottage cheese by like just spoons it and eats it. And she's like, just try it. And I was like, okay. And I tried it.
Yeah,
And I
it's a
almost,
texture thing. A way that I like it is like you blend it and then use
Yeah.
like the ranch powder packets and use it as like the dip for carrots or whatever.
oh, okay. Maybe I should try
But
it.
bottom
Maybe blend it
line
down.
is, eat what you like.
Yeah.
Some people don't like yogurt, some people don't like,
And trust me, the taste is
you know,
gonna change.
cottage cheese,
Yeah.
that's okay.
Yeah, I heard a lot about it.
Experiment, but
I
you.
didn't like it before surgery, and I still don't like it.
You still don't like cottage cheese?
I hate yogurt.
That's what I was
I
scared.
hate after
This was the
I
tea.
don't do
What
it.
time?
Stage
Yeah, because
three.
I'm on a GP.
What time?
I'm gonna, I do the shots right now. I lost 41 pounds already, but I'm
No,
doing that. I don't see
No, he was, you were.
I just-
Go ahead.
I never seen
Okay, we
it.
have one more
His was like
question
about
here.
5 or 7.
Yeah,
He was
I'm
7.
I think you were before me.
He was Dr. White.
Go ahead.
How long is stage
Wait,
three?
now I-
Yes.
2 weeks or?
Yeah, I had it
Stage
the
3
week
is
after.
3 weeks.
3 weeks.
Remember, 1 is 1 week, 2 is 2 weeks, 3 is 3 weeks.
Can we skip? Like I extended my leave to go back to work because I'm like surgeon here. I mean, 8 o'clock, 9 o'clock, 10 o'clock. I'm so tired of putting something in my mouth all the time. But I
Right.
follow that
But you should,
How
you
long
should
are
be
you out?
going.
How far are you
4
out?
weeks today.
4 weeks.
Yeah, so
Wow.
you're on
Yeah.
stage 3.
Yes.
So you should be going more toward 3 regular meals. and a couple snacks.
Oh, I thought we weren't supposed to snack.
Well,
No.
that's
I
okay.
do my
You're not-
protein shakes.
Yeah, that's
I have to
okay.
force
Count
them
that
down.
in. Yeah.
But I mean, I'm not, like the sample y'all gave us in the book, that's what I follow at 8 o'clock, 9 o'clock,
Oh my gosh.
10 o'clock, 11 o'clock, you know.
Yeah, but that was at the beginning stages. That's not stage 3 now.
You still have a sample in that too.
Yeah.
So I follow that.
Yeah.
So I'm trying
So
not
you
to-
should be heading more toward regular meals. Remember I
Yes.
said regular meals? And you know, you can probably only eat 2 ounces.
If I get 2 ounces.
Maybe,
yes.
you know, so that's why you should have some snacks in there to get it up there a little
Okay.
bit more. Yeah, just simply because you can't eat the volume, right?
Popsicles
How
are
much
a real
can you
good
eat,
snack.
Ryan, at one time, volume of protein?
Now?
Uh-huh,
Oh, I can get a good amount in,
like 5 ounces?
but probably good.
Yeah, but like, does that seem like, oh my gosh, incredible?
Yeah, I'm doing
Yeah,
it to finish my
but,
tube.
so once you get way out, you can eat larger quantities, you know. So we don't like you snacking all the time, you know, but until then, you have to have some.
What about juicing? Anybody juice? No juicing? Too
We're
much
not.
sugar, right? I just want to make sure. Yeah.
We'd rather you eat the vegetables, and
Yeah.
get the fiber, instead of squishing it all up and just drinking it, you know.
The examples, that does say you have Jello in between, Jello, 4 ounces of Jello and stuff like
Popsicles.
that. And sugar-free, of course.
Yeah.
Sugar-free, yeah.
Those contribute to your fluid, too. Yeah.
What other
That's
questions? Any other questions while we're here? Anything we can help with? Very good. Come
Thank
and
you
grab
all
one
for
of us
coming.
if you think of something. But hope y'all enjoyed it. It's always good to hear from someone else to normalize kind of mental health care. So.
And we also really want your ideas for the new year.
Yes.
I know I've talked to a few of you guys about some ideas, but if you have ideas that you'd like us to present, if you have ideas of outside people that you would like to hear,
And if you can't think of it, send us just a My Chart message to your surgeon and say, this is for Jenny, this is for Brianna, this is my idea for 1 month that I would
Yeah.
like to hear about. Please, we would love feedback.
or some of you that have been coming, you know, hey, I really loved this last year when you did ...
Yeah,
Can we do something similar, you know? Yeah, because it's your group, we want you guys to feel like your needs are being met.
very good. Good to see y'all.
Thank you all.
Thank you.
I've lost 27.